What's up? It's Alan Ramos,
Boom, 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 boom.
dancer, and you are watching PhilippineNews.com. At Harvage, Brian McDonald.
Thank you, Sandy, and thank you, Odette, and thank you, everyone, for joining us today. I want to give you a thanks and a shout out to the health plans that are here, PACE, and everyone. So thank you for coming today to make this a great event, and all of our panelists that you'll hear from as well. So what I'm going to do is I'm going to give you a brief overview of the program, and if you have questions following this, I will be around. My colleague Shelley, who is in the back, she will be around as well, and we will offer ourselves up for a follow-up after if you have questions as you write your articles and as you put the word out. So I just want to start a little bit with a little bit of a glimpse of what Medicare and Medi-Cal covers, so you get an idea of what the program is working with. So on the left side here, we have Medicare, and on the right side we have Medi-Cal. And so Medicare is primarily for folks that are 65 and older, and people that have certain disabilities. And primarily Medicare covers doctors, hospitals, prescription drugs, and some nursing facility at the short-term level. And then Medi-Cal, when we talk about Coordinated Care Initiative or how Mediconnect for Medi-Cal, we're primarily talking about long-term services and supports. And those are these programs here, which you may be familiar with. We have Multi-Purpose Senior Services Program, In-Home Supportive Services, which is in-home care. We have community-based adult services, and we have long-term nursing facility stays. So that's a lot of what, when I mentioned social services and the social care, that helps people live in their communities and their homes and be happy. And so part of the program is pulling these services in. And then you have also durable medical equipment and some Medicare cost sharing as well under Medi-Cal. So why is the Coordinated Care Initiative happening? So dual eligibles, people that have Medicare and Medi-Cal, are oftentimes have significant financial barriers, and then they have a lot of high-level health needs. And so that leads to poor health outcomes generally, and also a financial strain on the healthcare system. Most physicians do a great job coordinating care and providing the medical component of the services for their patients. However, this doesn't encompass those social services that I was mentioning, so a lot of people end up needing additional support when they're not with their doctor, and with their physicians oftentimes don't have staff to connect them with those social services, and that's not really their expertise. And so it ends up with a lot of folks not getting the proper care and the coordination that they need. And we do find that a lot of these dual eligible beneficiaries do have a lot of doctors, a lot of specialists, and a lot of prescription drugs. And so that's a lot to coordinate and a lot to manage. And oftentimes it falls on the person that's receiving the care and their family and their caregivers to actually be able to tell their physicians and specialists kind of what's going on with them, and that's really difficult to do. So the Coordinated Care Initiative is the new program that we intend and we hope that will help these issues that I'm talking about. And we'll talk about that more in a minute. As you can see in my last slide, or 2 slides ago, Medicare and Medi-Cal are definitely on one side and the other. And so there's not a lot of coordination, there's not a lot of conversation that happens between Medicare and Medi-Cal. And oftentimes the person that receives both Medicare and Medi-Cal is kind of stuck in the middle, and they don't really know what to do when they need help or if they experience problems with the system. And that leads to a lack of coordinated care in the system. So people don't get services that they need to stay out of the hospital, to stay out of the nursing facility, or to prevent return trips to the emergency room and things like that. The CCI is happening in 8 counties. I will not spend too much time here because we're in Santa Clara, so know that it's happening in Santa Clara, and that's going to be starting in January of 2015. So these are the 2 parts of the Coordinated Care Initiative. So on the left side here, we have Mediconnect. This program is an optional program. This part of the program actually is the part that coordinates the Medicare and Medi-Cal that I've been talking about. As you can see, it combines Medicare and Medi-Cal into one health plan to help coordinate their care. And there are also some additional services, including that care coordination, which is very important. And I'll talk briefly about those services in a minute. And I want to mention who this is for. Again, that's for people that receive full Medicare, so Medicare A, B, and D, and also Medi-Cal. So you have to, someone has to receive both in order to be eligible for Mediconnect. And then you have Medi-Cal, the Medi-Cal piece of the program. So if someone does not choose to join Mediconnect, because it is an optional program, they will still need to pick a Medi-Cal plan for those social services that I mentioned. So they want to continue receiving those social services, and to get some help with those, they will pick a Medi-Cal plan. That's a mandatory selection, so people with Medi-Cal only, or people that don't join Mediconnect, they do need to pick a Medi-Cal plan, and that's important. And there are also some smaller groups that are not eligible for Mediconnect because they don't have Medicare, or they don't have full Medicare, they might have Part B or Part A only. They would also need to pick a Medi-Cal plan. So getting a little bit more into Mediconnect. So Mediconnect, again, it's optional. We have the photos of the cards, so you can see that those two, they're putting Medicare and Medi-Cal together. People will not lose their benefits, so they still receive Medicare and Medi-Cal. That doesn't go away. But those services and those benefits are coordinated by the health plans. And you heard from the reps, the reps are here today for those health plans in Santa Clara. Folks will have one number to call and one health plan to help them if they run into problems with their care or experience issues in the system or denied services. There are additional benefits that I mentioned. So there's a vision benefit and there's a transportation benefit that are new and that all the Mediconnect plans will be providing to people that enroll into Mediconnect. And you can see how those benefits break out here. But the really important piece is the care coordination. So the health plans are going to have dedicated teams and dedicated specialists that are on the line of social workers and nurses that are dedicated to the patients and the beneficiaries to help them navigate their the healthcare system, their needs, and all that. And so that's really the cornerstone of the Coordinated Care Initiative, as you can see in the title. Key facts to remember about Mediconnect. It's voluntary. People do not have to enroll in Mediconnect on the Medicare side, but they do need to pick a plan on the Medi-Cal side, okay? Beneficiaries will be enrolled if they do not take action. That means that we're asking everyone to pick a plan. People need to know what's happening, and that's why you're here today, to help us get the word out. So people know that they need to make an active choice, otherwise the state will enroll them into a program that is a best fit program for them based on their past claims and some of their physicians and some of that stuff. Enrollment is usually by birth month, so people will generally be enrolled by their birth month, and that's the first day of their birth month. So if their birthday is January 24th, their enrollment date would be January 1st, and that's the first day that they would be covered if they chose to join Mediconnect. And beneficiaries can disenroll at any time, and that's part of the optional piece of the program. So if someone tries Mediconnect and it's just not for them, or they want to pick a different plan, they can make those choices as they are enrolled in Mediconnect, and that will happen the first of the next month. So if I chose today to change health plans, that would be effective December 1st for me. I just want to give an example so you can kind of understand what coordinated care would do for someone. So we have Ms. Lee. And Ms. Lee had a stroke and she's now living back at home. So before Mediconnect up here, Ms. Lee would have to navigate Medicare, Medi-Cal, and also the county agencies to get those social services I was talking about, because different providers provide all those different services. So Ms. Lee would have to navigate that system entirely on her own, or if she had family, or it would be kind of on her and her group of people that support her. And a lot of times she might be relying on her physician and their staff, which puts a lot of burden administratively on physicians, and they don't always have the time to do that because they're very busy. So under Mediconnect, if Ms. Lee was to join a Mediconnect plan, she would have a planned care coordinator, which is part of the care coordination, and that would ensure, her care coordinator would ensure that she had transportation to her follow-up appointments, that she had her medications properly sorted out, and that she was receiving those and taking the medications. If she needed help with Meals on Wheels or any other supports, that care coordinator would be there to help her. As we mentioned, in Santa Clara, the two Mediconnect health plans are Santa Clara Family Health Plan and Anthem Blue Cross. Here's just a representation, so you can kind of graphically see how the integration works here. So you have Medicare and Medi-Cal being combined into one health plan, and that's, again, here are the two health plans. And so that's how it would work if Ms. Lee, for example, chose to join Mediconnect. Now, getting back to that Medi-Cal piece, so there is this Medi-Cal choice that everyone that's eligible for the program that has Medi-Cal needs to pick. So either people are going to say no to Mediconnect, they would still need to pick a Medi-Cal plan, or if they're not eligible for Mediconnect for whatever reason, they still need to pick a Medi-Cal plan, okay? The Medi-Cal plan, again, they're going to keep all their same Medi-Cal services. That's not going to change. So here's some examples of some services, and I won't go through those for the sake of time. You do have them in your packet. And then the health plan will also help connect the beneficiary to these social programs that they need to help them live and stay in the home and community for as long as they want to. And we find that people are much happier when they can live and be safe and content where they're at, as opposed to living or residing in a nursing facility or having a lot of trips to the ER and in long hospital stays, because that's not good for anyone. Again, this is a mandatory decision. Some key facts, so it's mandatory. It does not change Medicare or how Medicare is built, because people would keep fee-for-service Medicare, so they'd still see all their same doctors if they just pick a Medi-Cal plan. Co-pays for physicians. I always want to put this out there. Patients should not, or beneficiaries should never be billed by their providers, and so this is very important that we let people know, because a lot of physicians that are confused about the program might decide that they're going to charge the beneficiary as that copay. That should never happen. That should be billed to the Medi-Cal plan, and that's part of the reason people are picking Medi-Cal plans, so they can have that support and that coverage. And also the Medi-Cal plans will cover all the copays and everything else associated with Medicare. And here's a representation of how that selection works. So someone keeps their Medicare as it is today, if they just join a Medi-Cal plan. So they keep their Part D the same. They'll use the same Medicare providers, so all their same doctors, hospitals, pharmacies. And then their Medi-Cal benefits will be assigned to the Medi-Cal plan, and the Medi-Cal plan will help them with that. And here is that this column shows that they're actually enrolling their Medi-Cal into Anthem or Santa Clara Family Health Plan. This is just one more graphical representation. This is someone that has Medi-Cal only, so they don't have Medicare, so they're going to pick a Medi-Cal plan, and they're going to enroll their Medi-Cal into Anthem or Santa Clara Family Health Plan here in Santa Clara. PACE, the program of all-inclusive care for the elderly, is a third option that people have. Now, there are some very specific criteria here, so PACE isn't available for everyone, but it's a great program that provides very similar services to the Mediconnect plans, and it's all center-based. So people go to the center and they see all their physicians, their specialists, get all the therapies and treatment, and there's also social services provided by PACE as well. These are the criteria, and so if someone wants to be evaluated for PACE as they make the decision, they certainly can, and they will be evaluated by the local PACE, which is OnLock here in Santa Clara, OnLock Lifeways. So they do have a choice to join PACE if they meet those criteria. So what to expect? So beneficiaries will receive 3 different notices from the state. So and it's 90, 60, and 30 days ahead of their coverage date. So for people enrolling January 1, which is the first enrollment that's going to take place for Mediconnect in Santa Clara, they've already received their 90-day notices, and they got those in October, 90 days ahead of January. And then this month, they're getting their 60-day mailing, so they're going to get another notice from the state letting them know what's happening, letting them know they need to make a decision. And then 30 days out, they're going to receive another notice from the plan, or not from the plan, I'm sorry, from the state. And the state's going to let them know what plan they picked or whatever decisions they made in the past. And that's going to notify them that they will be enrolled starting January 1st. And those notices will start coming in December, 30 days ahead of January. For most people, again, their coverage is the first day of the month. They don't have to wait till their birthday. They just their coverage starts January 1st if their birthday is in January. And it steps out each month after that. Mediconnect information will come in, and Odette has a nice blue envelope here. So blue envelopes, that color with those markings, that's what will come to people. So if if you're working with folks or if you are receiving these notices, that's what it looks like. And we have a graphic up here. Don't throw this away, it's very important information. My last two slides here, I just want to talk about, because a lot of folks, when people join Mediconnect, they will need to use the doctors and specialists in the network of that plan, and if they join PACE, they also need to use the PACE providers. So continuity of care actually becomes a very important piece because it allows people to continue to see some of their doctors if their doctors don't join the networks or are not already in the networks. And so for Mediconnect doctors, so if it's a Medicare provider or if they're providing Medicare services, they can see that provider for up to 6 months. If it's a Medi-Cal provider or a Medi-Cal service, they can see that provider for up to 12 months. Again, that's seeing a network, a physician or a provider that's outside of the network, and they can engage in what's called continuity of care. And that allows people to continue to have their treatments. They don't have to cancel appointments. The health plan will reach out, or their doctor will reach out to the health plan, and they can engage in continuity of care. There are a couple criteria that they need to meet. It can't be a brand new physician. So the payment will be the same, so doctors aren't losing any money by providing continuity of care for their patients. So it's the Medicare and Medi-Cal fee schedule that they will be paid. A beneficiary must show an existing relationship. That's an important piece. So like I said, it can't be a brand new physician or a brand new specialist. It has to be, if it's a primary care physician, they have to have seen that doctor once in the last 12 months. And if it's a specialist, they have to have had 2 visits in the last 12 months. And one specific note here is that does not apply to ancillary providers, so a transportation provider or durable medical equipment, some of those services. If someone picks Mediconnect, they would have to immediately start using those providers that are part of the plan network, okay? But it does apply to primary care physicians and specialists. That's my overview. So I'm going to turn it back to Sandy. Like I said, I know that's a lot of information I just threw at you, but I'll be available, my colleague will be available, and we'll do follow-up if you have questions. So thank you.
Thank you. I want to thank you for inviting me here. I think that this is an issue, or this is a program that is attempting to address a big issue that we face. We as physicians, we as a medical group or a medical system or a healthcare system face every day with our patients. I'm a geriatrician, and that means that the majority of my patients are patients that are in this vulnerable population. The people who come visit me in the clinic are generally patients that their primary care doctors feel like need that extra eye because they're concerned about certain things that aren't happening in the home, or they're concerned about the complexity of medication regimens and about goal setting for folks who are transitioning into a different stage of life. So I'm going to share just a little bit about 2 different care settings that I participate in, and hopefully I'll highlight for you a little bit about some of the frustrations that we face as physicians, as folks who are actually trying to, every day, trying to improve the health of our patients in the community around us. The first care setting is in the clinic, and this is how a lot of us here in the room access care is when we go to our doctor's office. There is a lot that we can do in the doctor's office, but I think we all know that there's a lot that we can't do in the doctor's office. And we as physicians, we try to do the best that we can with our limited time with you to do education, to build on the relationship, understand who you are so that we can address your healthcare issues better. And of course, we also are there to address your immediate issue, the issue that brought you in. That's a lot to accomplish during a short period of time, I should say. And one of the challenges when folks have chronic illness is that people do need follow-up as outside of the office. They need things like making sure that they have meals that are healthy, making sure that they have transportation to their next appointment, to their next specialist, making sure that that their family members are listening to the instructions that we're giving them. If they can't, if the patient themselves can't manage their medications, oftentimes these patients are on 8, 9, 10, sometimes 20 pills a day. Family has to get involved to help sort that out. These are the sorts of frustrations that we have as physicians, is that we can't be in the home, and this is one of the great things about coordinated care with Medicare and Medi-Cal working together, is that you start to have a more natural relationship, that what happens in the home and the caregiving that happens in the home and the transportation and social issues, which are so important to healthcare, are acknowledged as such. So there's a combination and a coordination that should result in better care for the folks who are in this program. The second care setting that I'm going to speak to is actually where I spend the majority of my time, and that's in the nursing home setting. At the Palo Alto Medical Foundation, we support a lot of sort of innovative programs, and I'm involved in starting a program that has tried to improve healthcare delivered in a nursing facility, because it makes no sense to spend tens of thousands of dollars in the hospital only to go to a nursing home and have everything fall apart. What we see in the nursing home, what I see in the nursing home is a lot of this where patients do get sicker and then they have to go back into the hospital, and there's a revolving door. One of the things that we've been trying to implement is a system that allows nurses to have more capabilities and to do better assessments. And in the process, what we've been able to do is we've been able to get people better. We believe we've been able to get people better more quickly. We also believe that we've been able to help people who reside in long-term care facilities stay in their home environment, which is a long-term care facility, rather than having to go through the ER, which is, anybody who's gone through the ER knows that it's not a pleasant experience, and it's not quick. The question is, how do we provide the best care in this setting? Well, sometimes when there are things that I want to do for a patient in a long-term care setting because Medi-Cal is paying for it, paying for the person residing there. But if I want to be able to treat someone with an IV antibiotic or with IV fluids to get them, to keep them out of the hospital, or if I want to do some diagnostic testing, these are things that are costly and frankly not covered by Medi-Cal. So the norm, the standard, not just in this area, not just in California, but nationwide, is to just send those folks back to the hospital. And once the hospital stay reaches a certain point, then those patients are now covered to get the care that they could have already gotten in the first place back in the nursing facility. And the reason why is because they have two different payers, Medi-Cal and Medicare, and they don't work well together. So the promise of a program like this is great. I'm happy to be here, and I think you're going to hear a lot more personal sort of stories about how that affects the individual
Opportunity to speak at this event, and for everyone that took the time to plan and coordinate it, obviously very well done. So I wanted to give a little background of my organization and what our role is in this whole demonstration project that's coming out in Santa Clara. So Bay Area Legal Aid is a legal aid organization. We have a local office in Santa Clara, just a few blocks from here. And we provide free legal advice to residents of Santa Clara County in all areas of law, including, for this project, health law. So we do Medi-Cal, private insurance, issues we've covered California, but essentially, we advise people on what their legal rights are, especially in relation to managed care plans. And in the context of the Coordinated Care Initiative, we are designated the Cal Mediconnect Ombudsman, and our role is to really act as an advocate for dual eligible beneficiaries who may or may not be affected by Cal Mediconnect if they choose to enroll or if they choose to opt out. But what we can do is provide a lot of information, advice, as well as representation where it's needed. If they're experiencing problems with accessing care, there's a lot of moving parts with this rollout, and for a lot of the dual eligible beneficiaries who are now receiving these notices, managed care system and delivery of health care is very, very new, and there's a lot of confusing terms, a lot of just a lot of conflicting information or misinformation that is being sent out. So it is very important that everyone is aware of what this program is and what the rights are and all the education that's being given to a lot of these dual eligible beneficiaries. At Bay Area Legal Aid, we get a lot of calls now that these notices are going out from caregivers and relatives of dual eligibles who are receiving these blue envelopes. They're unclear what's going on and very concerned that most of the time it's concerns that this is a negative action, that something is happening to their health care. So it is very heartwarming to get these calls from relatives who are very concerned about their parents, many of whom are probably monolingual or get these notices that are in a language that the children don't understand. We get a lot of that as well. And once explain to them what the benefits are, which I think are a lot of great benefits that the Cal Mediconnect can offer. There are a lot of rights that beneficiaries get in managed care plans, including for the Cal Mediconnect side, the vision benefits and the transportation benefits, as well as that very important care coordination and the option to have these care coordinators or the care team to really make sure that beneficiaries' healthcare needs in all aspects, whether it be the physician side, if they're seeing specialists, or for many of whom who are disabled and need in-home supportive services or more care within their home, having all of the providers and the services really coordinated and aware of what each individual person needs in their healthcare delivery. For like anecdotal examples, a lot of people are very excited about the vision benefit. They hear about it, and the fact that they get a routine eye exam and financial help in paying for the prescription glasses with contacts. Like that's something that, for a lot of beneficiaries who have been in the fee-for-service model, but they're not part of a health plan, this is something, that's big. For dental, that's also a Medi-Cal benefit, but that's provided by Denti-Cal. It's going to be carved out from the Cal Mediconnect plans, but it is for everyone that's a Medi-Cal beneficiary. They do get Denti-Cal and dental services.
Great. I can't resist asking Shelley Grimaldi to just reinforce what you said with the story of a Russian elder person who got a prescription. Do you want to just share that story? Because it punctuates exactly what you were saying.
Sure. Am I speaking loudly enough?
Yes.
So this is more of an anecdotal story about the value of coordinated care. I was doing a presentation here in Santa Clara County at a senior resident building, and this man who speaks only Russian through a translator was telling me this story about how he had a prescription filled for new glasses, brand new prescription, stronger. He brought the prescription to have the glasses made, and when the glasses were actually given to him, they weren't correct for some reason. And he was unclear whether it was the prescription which wasn't filled out correctly or whether the glasses weren't made correctly. And it was, as a member of the fee-for-service system, it was his responsibility to figure that out on his own. And until he did that, he had glasses which were not useful to him. Under Cal Mediconnect, that would be a situation in which he could call his care coordinator at the health plan and say, I'm not exactly sure why these glasses don't work, but I need a replacement. And that care coordinator could work with both the store that produced the glasses and the doctor who wrote the prescription to figure out where a replacement could be made. And that person wouldn't have to figure out whether it was Medicare or Medi-Cal that would pay for that replacement.
Great, thank you. And the Fair Legal Aid is the ombudsman for the Coordinated Care Initiative. So you're sort of the safety net, fallback if things aren't going right.
Yes, well, for the legal side, that's where we can step in when, there are problems that might arise when there's, miscommunication or misinformation, that come out.
Great, thank you so much. Now our third speaker, who's on the front lines of this program, is Marcelo Espiritu, who is the product analyst, health insurance counseling and advocacy program, otherwise known as HICAP. We've always asked for a HICAP representative because you too are like a troubleshooter for this population of low-income seniors and people with disabilities trying to navigate the system. So your view on the Coordinated Care Initiative.
All right. Good morning, everyone. Thank you, Sandy and Odette and Shelley, for helping to organize this gathering. And thank all of you as well for being here to convey to your respective communities about what duals are experiencing as the CCI rolls out in Santa Clara County. The program where I work, for those of you who are not familiar with it, HICAP serves as the local source of help for anybody who has Medicare. People have Medicare, and typically they have other insurance as well, so people can purchase private Medicare insurance plans in addition to Medicare A and B. They can also have insurance from an employer or an ex-employer or from a military benefit. And today, of course, we're talking about people who qualify for Medi-Cal as well. All of them come to us with the same question: how does it work? How does Medicare work? How does my insurance work with Medicare? So it can be confusing, and now with this new program, people with Medicare and Medi-Cal have additional issues to sort out. So today I'd like to talk to you about what we're on the letters that go out. We're a point of contact to help people sort through their options. So I'd like to walk you through what we've been hearing, who's been calling, what their questions have been, what people are doing, and some of the issues that we've been hearing about. First of all, who's calling us? Of course, the beneficiaries. But then most of them have people caring for them. So we talk to sons and daughters, we talk to grandkids, we talk to grandparents, significant others. We also hear from professionals, social workers, people at low-income housing complexes. What's prompting them, of course, is the blue letter that they're receiving 90 days before their enrollment date. Some of them call us right away, some of them wait till the 60-day letter. There's an additional letter that prompts a call, and this is a letter that comes from their Medicare Part D drug plan that informs them that they're losing coverage as of 2015. This causes a lot of concern, and so we address those calls as well. Some people call because they're simply wondering why they haven't got a letter yet. So there's been a lot of outreach. For example, Mao, she's Vietnamese, she's a widow. She heard from a newsletter that if she didn't decide about her health plan, that she would be enrolled in something automatically. So she's a bit concerned. Talking her through, we found out that she could probably expect a letter next year, 90 days before her birthday in November. So she's going to hold off until she gets a letter. What are people feeling? So when people call, a lot of voices convey a range of emotions, but predominantly it's concern and a sense of urgency, knowing that if they don't do something, something will happen. There's also confusion, so especially people who receive the 90-day letter, it simply says, there's this thing called Mediconnect, look for the next letter. We get calls, people are asking, what is Mediconnect? I don't understand what that means. So we have to describe, we meet people where they're at. Some people know what they have, some don't. So we talk about how Medicare works, Medi-Cal works, and then the benefits of Mediconnect. After talking to a number of people now, the main concern really is, will I get to see my physician? Will I get to continue to see my doctor? That is the number one concern. I talked to Ben, who's also Vietnamese, through the language line. Talked to him about what the benefits were, the 3 different benefits, and then he said he had 12 doctors. So we went through the 12 doctors to check and see. 9 of the 12 are participating in Mediconnect. 3 aren't. And it's those 3 that are still very important to him. So he's undecided at the moment. He's going back to talk to his doctors to see if they'll participate. For some people, it's quite easy. So we check, their doctors are on the list, and they sign up. So Vitaly, he speaks Russian. His concern was whether he could go to a CBAS center with one of the plans. And we checked on his primary care doctor. He's in the network, so he's going to sign up. Garnet is a son who called for his father, Channon. They wanted a little more information. They'd already checked with their doctor, and so they're going to join Mediconnect. Now, even though things align for people, all their providers are in network and so forth, change is difficult for people, and sometimes change causes trouble. And I think that some of the people we talk to have learned this by hard experiences, so they don't want to change. So Renee came in with his 61-year-old wife, Elizabeth. They received, we reviewed the benefits, checked the network, and sure enough, bottom line, if they opted out, they could continue with everything as it was. If they opted in, they could still see their doctor and receive mental health benefits and so forth. But, and drugs were concerned. Would I have to pay more? No, everything would be the same. Still, change was just not on the table. So they're deciding to opt out because they just want to keep everything the same. Many of our callers have already made up their minds, and usually this is a brief phone call. And like Narayan is 74, primary language is Hindi. He said he just wanted to know how to opt out. So we walked him through calling healthcare options, the enrollment broker, asking for written confirmation that this is your election, but you still have to pick a Medi-Cal plan. So we kind of have to walk people through what does it mean to be in a Medi-Cal plan in an HMO, so to speak, and yet I can still see my doctor that's not part of that HMO. So we have to describe what that means for people and how, yes, you can continue to see your doctor even though you're in a Medi-Cal plan. Antonio, he's 70 years old. He has a longtime girlfriend who called. We went through his doctors. 2 of them were on the list, 2 weren't. And again, right away, they're deciding to opt out. About a third of our callers are undecided right now, waiting for more information or waiting for the 60-day packet to come in. Leon from Milpitas, he was calling for his 88-year-old Filipino father. Apparently his doctor had asked Alejandro whether he was going to join Mediconnect or not, so they were calling to find more information out about it. So they're seriously considering it as sort of a reference from his doctor. Some of the difficulties we've seen, we have relatives who are trying to help their loved ones. As if you're not a designated appointee in the system, then healthcare options will not talk to them. To get on as a designated representative, you have to work with Social Security. So you have to contact the Social Security Administration if you want to help the person without them on the phone. So that's been a little bit of a difficulty for a lot of people who can't speak on their own, people with Alzheimer's or people who just need a lot of extra help. Additionally, we're finding that people who opt out and join a Medi-Cal plan are being misinformed about not being able to see their current doctors. So we're working with this with Harvard, and I think the word has really been getting out more that yes, you can continue to see your doctor if you opt out. of Mediconnect, even though you join a Medi-Cal plan. But this is a concern for a lot of people. So this is what we're seeing on all the phone calls. We're receiving about 40 to 50 calls a day when it comes to the CCI, in addition to the annual enrollment period, so people with just Medicare calling in. But that's the report from the front line at HiCAPS.
So I have two stories here to share with you. One of the family that I've been helping with because they don't speak English. And it's a very compelling story. I'm talking about a sick, elderly taking care of her own mother, who's 93 years old. The daughter is right now 57, and she's also receiving Medicare only. But the mother, however, is receiving both Medicare and Medicare, and they both don't speak the language. The only time that they can get out of the house is to their doctor's appointment, and that has to rely on their grandchildren many times. Making phone calls to this doctor is really it's very hard for them, because if they know, they're going to call the doctor up and then they say, press 1 for English, press 2 for Chinese, press 3 for Spanish, and press 4 for Vietnamese, and so on. If they understand that, they would call. So they have, even making an appointment to a doctor, they have to rely on their grandchildren or their neighbor or myself to make that phone call for them. A couple of months ago, the mother, her mother, had an eye surgery, and she has to go to a specialist. And now that again, many of these eye specialists are monolingual; they only speak English. So the grandchild have to take some time off of work just to do that for her. That's it. And another story is about my own story. Is my own experiences. I'm living with my mother-in-law. That's how most of these Asian families are living. From first 3 generations together in a home. And again, every time that when I have to, the only way that she asked me to make an appointment to see a doctor is when her medication run out. She's both receiving Medicare and Medicare. And in addition to that, I have 2 small children as well too. So it's very hectic during daytime, and trying to get through a doctor to make an appointment for her is very hard. Again, that's intimidated her. So, and I have to do that for her, providing transportation and taking time off from work, especially when it's like 2 or 3 o'clock is a no-no, because that's when my children need to be picked up from school. And again, by the time we get to see a doctor, her illness has only get worse. So, and the quickest way for me to get her medical treatment is to go to emergency room. Put her there, emergency room, and put her there. It's much easier and it's quicker for me to do that.
You mentioned before to us that it was a nightmare. It was very hard for you to find a specialist for your mother-in-law. Can you remember that?
Yeah, when she was having a kidney infection, and the doctor referred her out to a specialist. And of course, when she go to see her family doctor, and then her family doctor have to refer her to a specialist, and we have to wait for an insurance company to get an approval. And by the time that she got an approval from her insurance company or from Medicare, her condition is already very bad. So I just took her to the emergency room and have her taken care right there.
So this is the life you're leading now. I'd like to just ask Dr. Land, how do you see Cal Mediconnect, the Coordinated Care Initiative, helping from the
Yeah, thank you for asking. While I can't provide details specific to California Mediconnect, I can tell you how coordinated care should work. Whenever folks get their primary care issues in the emergency room, that's already, a failure of the system. And I think that there's a lot that needs to be done in terms of making access to care culturally accessible. And I think that you can get that when you have coordinated care systems. The whole idea with a coordinated care system is that you will have one place to call, and that one place to call is going to be managing your care specifically. They're going to know what appointments are coming up. They're going to know what needs you have. They're going to be in communication with the physician who says, hey, this person needs to see a specialist. That is how coordinated care systems are designed to work.
And in addition, transportation, either Marcelo or would either of you like to talk about how Cal Mediconnect will, by combining Medi-Cal services with Medicare doctors coordination, how can that help with transportation, for example, to and from doctors?
And another thing, does Cal Mediconnect has prescription drop off and pick up too? Because that's going to be a chunk of time for me to do that as well.
Shelley, do you want to take
Yeah. So you'll remember the slide with Miss Lee after her stroke. She's gone home, and under Cal Mediconnect, she had an allied health plan through that care coordinator role. So those care coordinators are supposed to be language specific. If Miss Lee only speaks Cantonese, her care coordinator should speak Cantonese so that she is a valuable resource in the connection. The health plans are going to grow their employed care coordinators as they have more enrollment, and who they employ to be those care coordinators is going to reflect the demographics of who enrolls, so that your mother-in-law who needs a Vietnamese-speaking caregiver would have a Vietnamese-speaking caregiver. So when she calls, she can access, and she doesn't necessarily have to wait for you to call for her.
And what about the prescriptions? Thanks, Shelley. What about the prescriptions? Will these be, we're not looking at Wonder Woman suddenly coming and solving all the problems, but will there be, the mobility issue is so huge for the population we're talking about. Will Cal Mediconnect help with coordinating both the prescription and the actual transportation?
So people who have Medi-Cal already have a transportation benefit. They can arrange for non-emergency medical transportation to a doctor's office. What Cal Mediconnect gives is 30 additional one-way trips to their members, with a little more flexibility, so not limited to just non-emergency medical transportation. So this is more like a taxi voucher type benefit. And as you said, this population tends to have transportation needs, like you said. Some don't because they have their kids that can help a lot. So some really like it. We have drug coverage is included, so it is a Part D drug plan, and is mail order included in that? In fact, maybe we could get the plans to answer that about their particular.
Yes.
It is, okay. See, this is hard to figure it out. There's just every damn possibility that could arise in an individual life. And so that's why this isn't just one slick story. It's really looking at this from the standpoint of people's real life experience. So Amir, you have a question, and then we're going to our last two testimonials.
I had a question. When you were doing the presentation, you said that it was for anthem groupers and Santa Clara. Why is the Kaiser not part of this?
Kaiser is participating in a very limited role in some of the counties, but only on the Medi-Cal side. It was Kaiser's choice. I think part of it is Kaiser provides a lot of a similar model of care as Mediconnect. So I think that it was kind of a decision on Kaiser's part.
So I'm sorry I interrupted the flow. It's just that these stories.
Santa, magandang hapon sa mga Filipino media. And so I'm Odette Keeley, New American Media to translate for Tita Chris, whom I met at the JDS Northside Community Center, not very far away from here, so also in Japantown, San Jose. So mahiyain ko si Tita Chris. Tita Chris is a little bit shy, but I'm going to let you. Oh, there you go. She line dances. She told me I gotta go back with that to my line dance. Tita Chris, I'm going to let you introduce yourself. You can do it either in English or Filipino, and I can translate it.
Magandang hapon po sa mga Pilipino at American and other people. Ako po ay si Crisanta Alas Salsala, AFLAS. Ako po ay isa sa nakarating ng Amerika 1993. But afterwards, I go to Chicago with my auntie. Then I lived there at 6 years. When she go home, I came here in California with my husband.
So the beginning of what Tita Chris was saying, she's Crisanta alias, 87 years old, a Filipina living here in San Jose. I'm one of the regular volunteers in JDS Northside, and I came here to America in December of 1993. And since 1998, I have been living here in San Jose, California. And since 1998, you also have been a Medi-Cal, Medicare beneficiary before?
Yes.
And so she was also starting to relate to us in English, living in Chicago with some of your family members. So continue.
Yeah. Then afterwards, I worked in Northside Community Center. Before, only volunteers within 3 months. And afterwards, they give me little bit money. Then, as soon as I'm working, they give me a form to apply for to work in Northside Community Center. So that's why I am doing that. Since 1998, I worked in Northside Community Center and as a volunteer.
Ano po yung dati yung healthcare plan, Tita Chris? Tsaka okay po ba yung inyong coverage? What was your health plan previously and what's your
My
coverage?
healthcare is federal. Federal.
Yun po ba yung United American
No, not
Healthcare?
yet.
Okay. So her previous health plan was federal, and ano po yung ang karanasan po ninyo dun sa inyong coverage? What was your experience, Tita Chris, with your coverage in federal as your health plan?
They give me free everything. That's right.
Kailan po kayo nagsimula sa United American Healthcare? When did you start switching
Last
over?
year only.
Okay, and yung nabanggit niyo po sa akin, Tita Chris, na may natanggap po kayong letter na disenrolled na po kayo sa United
Yeah.
Healthcare. Tita Chris was telling me that she received a letter that she was disenrolled from United American Healthcare.
Yesterday I received that they just enrolled me again. That's why.
Okay, so
So I'm thinking, what can I do?
So this is a case that I think needs to sort out. It may be something very specific that's happening to Tita Chris, where she's saying she received a letter that told her she was now disenrolled from United American Healthcare. And this is what she's remembering now. And that you have now been enrolled again. So bumalik po, in-enroll po kayo ulit.
Yes.
So, ano po yung mga karanasan po ninyo ngayon sa pagpunta sa klinika? Malapit po ba?
Clinic is only in the Canara Street with Dr. Noyen, Vietnamese.
So, nabanggit niyo po sa akin, you mentioned you chose Dr. Nguyen dahil mas malapit. So, you
Yes.
chose this doctor because she's closer to your
Yeah.
home.
That's right.
Have you been receiving any particular treatment? Meron po kayo naging mga direct operasyon o...
No operation.
Tita Chris is like one of the healthiest 87-year-olds I've ever met. No major operations in all the years he's been in the United States. No major surgeries or serious illnesses. Wala po. No, kasi line dancing. It's the line dancing. So, kung narinig niyo po itong Mediconnect po ngayon, Tita, kung matanggap niyo po itong envelope,
Yeah.
kasi kailan po ba ang birthday niyo?
April 4.
So her birthday is April 4. Kung hindi niyo po ito natatanggap pa,
I received it.
So you
but
actually
I did not apply yet.
one of the things that she told me is also her friend helps her with the language. When she receives any letters or messages from her doctor, her friend would discuss it with her, talk to her in Filipino, and tell her what she needs to know. So binasa niyo po yung laman po nito.
Not all.
Not all yet. And then you
Because I
saw,
have this in the North China.
and you saw a choice for Santa Clara Family Health Plan, so pinag-iisipan ng po. So she's still studying the contents and studying her choices. And I think, ano po yung siguro ang ating mong ending eh, ano po ang inyong gusto na para mas magandang access po sa inyong healthcare? What would you want how Mediconnect to do for you to help?
I want Medicare. I want California Medicare. I am thinking because the doctor is far. That's why. So if in order, I have to far. I am only Cadillac. This one Cadillac.
That's Cadillac, that means walking. So, maraming salamat po, Tita Chris. Thank you.